Good morning. Today we're gonna talk about the hepatitis B virus. Hepatitis B is a serious liver infection caused by the hepatitis B virus HBV, which is a partially double-stranded DNA virus of the family Hepatnaviridae. For most people, hepatitis B is short-term, also called acute, but for others, the infection becomes chronic. Most adults with hepatitis B recover fully, even if their symptoms are severe. Infants and children are more likely to develop a long-lasting hepatitis B infection. A vaccine can prevent hepatitis B, but there's no cure if you have the condition. If you're infected, taking certain precautions can help prevent spreading the virus to others. WHO estimates that 254 million people were living with chronic hepatitis B infection in 2022, with 1.2 million new infections each year. In 2022, hepatitis B resulted in an estimated 1.1 million deaths. The burden of infection is highest in the WHO Western Pacific region and the WHO African region, where 97 million and 65 million people respectively are chronically infected. The prevalence of HBV in Lebanon is 1.74%, with a higher prevalence in South and Nabatieh districts. These data rank Lebanon amongst countries with low endemicity for HBV. HBV is classified into 10 genotypes and 40 subgenotypes still today according to the phylogenetic analysis. Genotype A is predominant in the Northwest Europe, North America, and Africa. Genotypes B and C prevail in East Asia and Far East countries, while genotype D is widespread worldwide. Genotype E occurs only in West Africa. Genotype F has been found in Central and South America, and genotype G has been reported in Turkey, France, Canada, Vietnam, Germany, and America. Genotypes H and I have been isolated in Central America, Mexico, Vietnam, and Laos. The recently identified genotype J has only been found in Japan. Let's talk right now about acute versus chronic hepatitis B. Hepatitis B infection may be short-lived, also called acute, or it might last a long time, also known as chronic. Acute hepatitis B infection lasts less than 6 months. Your immune system likely can clear acute hepatitis B from your body, and you should recover completely within a few months. Most people who get hepatitis B as adults have an acute infection, but it can lead to chronic one. Chronic hepatitis B infection lasts 6 months or longer. It lingers because your immune system can't fight off the infection. Chronic hepatitis B infection may last a lifetime, possibly leading to serious illnesses such as cirrhosis and liver cancer. Some people with chronic hepatitis B may have no symptoms at all. Some may have ongoing fatigue and mild symptoms of acute hepatitis. The younger you are when you get hepatitis B, particularly newborns or children younger than 5, the higher your risk of infection becoming chronic. Chronic infection may go undetected for decades until a person becomes seriously ill from liver disease. A person may have no symptoms, mild symptoms, or serious symptoms. It is more likely to have one if the infected patient is 30 years or older. Symptoms usually start within 90 days after being exposed to HBV, although it can take up to 6 months. The patient may feel sick for a period of days or weeks. They may become very ill very quickly, called fulminant hepatitis. In case of having symptoms, they may include 1. Fever, 2. Fatigue that lasts for weeks or months, 3. Belly pain, 4. Light colored stools. It may look clay colored, which is a light gray, beige, or white. 5. Jaundice. Your skin or the whites of the eyes turn yellow and your pee turns brown or orange. 6. Appetite loss. 7. Muscle and joint aches. 8. Nausea and vomiting. 9. Dark urine. And 10. Pain in the abdomen. Symptoms will go away in a few weeks to months if the body is able to fight off the infection. Some people never get rid of the HBV. This is called chronic hepatitis B. Infants and children younger than 5 typically don't have symptoms of acute hepatitis B. Older children and adults are more likely to have symptoms. If a person has chronic hepatitis B, they may not have symptoms until complications develop, which could be decades after they were infected. For this reason, hepatitis B screening is important, even if they have no symptoms. People with chronic hepatitis B may be asymptomatic and may not know that they are infected. Over time, they may develop symptoms of liver damage and cirrhosis of the liver. An individual can spread the HBV to other people even with absence of symptoms. The virus is passed from person to person through blood, semen, or other body fluids, even in microscopic amounts. From a person infected with the HBV enters the body of someone who is not infected. Hepatitis B is stable on environmental surfaces for at least 7 days, and it is possible to pick up the virus from inanimate objects. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the hepatitis B virus ranges from 40 to 160 days. The virus may be detected within 30 to 60 days after infection and can persist and develop into chronic hepatitis B, especially when transmitted in infancy or childhood. It does not spread by sneezing or coughing, hugging, breastfeeding, or through food or water. Common ways that HBV can spread are 1. Sexual contact. You may get hepatitis B if you have unprotected sex with someone who is infected. The virus can pass to you if the person's blood, saliva, semen, or vaginal secretions enter your body. 2. Sharing of needles. HBV easily spreads through needles and syringes contaminated with infected blood. Sharing number 4 drug paraphernalia puts you at high risk of hepatitis B. 3. Accidental needle sticks. Hepatitis B is a concern for healthcare workers and anyone else who comes in contact with human blood. 4. Mother to child. Pregnant women infected with HBV can pass the virus to their babies during childbirth. However, the newborn can be vaccinated to avoid getting infected in almost all cases. It is recommended to talk to a provider about being tested for hepatitis B if you are pregnant or want to become pregnant. 5. Poor infection control in health care facilities. 6. Using unsterilized equipment. Getting a tattoo, body piercing, or medical or dental treatment in a non-sanitary environment with contaminated equipment. 7. Blood transfusion. If hepatitis B infected blood is given to any person, it can transmit the infection to them. 8. Sharing contaminated personal articles. Sharing contaminated toothbrushes or razors might spread hepatitis B virus. 9. Blood from an infected person contaminates an open wound. When an infected person's blood enters another person's open wound, it can lead to hepatitis B virus transmission. Hepatitis B infection acquired in adulthood leads to chronic hepatitis in less than 5% of cases, whereas infection in infancy and early childhood leads to chronic hepatitis in about 95% of cases. This is the basis for strengthening and prioritizing infant and childhood vaccination. Chronic hepatitis B develops when your immune system fails to fight off the virus. Most people successfully fight it off during the acute phase of the infection. The acute phase is when your immune system recognizes the virus and launches its attack. When you have symptoms of illness after an infection, such as fever, nausea, and vomiting, those symptoms are part of your immune response. Your immune system is trying to get rid of the virus by purging and burning it out. That's the acute phase. Sometimes, some people's immune system don't succeed in clearing the HBV virus during the acute phase. For various reasons, their immune response is weaker than necessary. The acute phase only happens once. If the virus survives, there isn't another one. A person might have a weaker immune response to the virus if they 1. Are a young child whose immune system is still developing, 2. Have another infection at the same time, 3. Have a chronic medical condition that compromises their immune system, 4. Receive immunosuppressant therapy or chemotherapy.